Chair Nelson and members of the board. Departmental item number 5 is from the County Executive Office. It is a hearing to consider recommendations regarding an update on the coronavirus disease 2019 COVID-19.
Good afternoon, Chair Nelson and members of the board and our CEO. And I am happy to be your last item. It is quite late, so I will proceed quickly. Today's briefing topics will include the current rates and a brief overview of the vaccination and booster data, as well as share with your board the latest CDPH guidance. And Dr. Ansor will give a briefing on the Omicron variant. Next. As you can see, the new cases, we have 21 new cases as of yesterday, and we have 416 active cases. Our total cases in Santa Barbara County stands at 46,655. We are reporting a current case rate of 12.8 per 100,000. We are not reporting new deaths as of yesterday. The number of COVID-19 patients hospitalized is 39, with 554 total deaths in Santa Barbara County to date. And lastly, our testing positivity as of December 9th is 3.5. Next. This graph describes our case rates by vaccination status. So as you can see, there's quite a difference between the trend for case rate among the vaccinated versus unvaccinated individuals. Vaccines prevent serious illness, saves lives, and reduce further spread of COVID-19. As more people are vaccinated, the virus is then less likely to spread, mutate, and potentially become even more dangerous. Vaccines are the key that will help us put an end to this pandemic. So the bottom line reflects the case rate among vaccinated individuals in our county, and that is 6.2 as of December 2nd. The top red line reflects the case rate among unvaccinated individuals, and that case rate is 24.1. So for this time frame, the unvaccinated are almost 4 times more likely to get COVID-19 than fully vaccinated people. And this is a trend reflected statewide. In addition, with California's data, we also see that there's roughly a 12.5 times difference between unvaccinated people and vaccinated people in hospitalization, as well as in death, about a 13 times more likely. Next. This graph describes our hospitalization. Hospitalization increased 34% over the past 2 weeks, and this is not a surprise. We anticipated increase in cases and increases in hospitalization following the Thanksgiving holiday. What is worrisome is that our ICU rates increased by 120%. Currently, we are good with hospital capacity, but that capacity really is very tenuous given the other respiratory illnesses in our community. I'd like to share with your board that the state modeling predicts that we will see an additional 38% increase in hospitalization due to COVID in the next few weeks. Next. This is how CDC describes level of community transmission. So they have a low transmission as 0 to 9.99 new cases per 100,000 persons in the past 7 days. With moderate transmission, it is 10 to 49.99. With substantial transmission, that is 50 to 99.99. And with high transmission, that would be anything above 100 cases per 100,000. So, as I shared earlier, the current Santa Barbara County daily case rate is 12.8. So, what you would do is multiply that by 7. So, that would be 89.6 per 100,000 for 7 days to mirror the CDC measurement. So, what that means is that according to CDC, then with our numbers, we have substantial transmission in our county. Next. Next. So I'd like to briefly go over some standard data and some new data regarding vaccination and booster shots. 63.8% describes the percent of Santa Barbara County as fully vaccinated. The number is a little bit higher when we look at the eligible population, the 5 and above, and that number stands at 67.8%. Next. This is new data. This graph describes the vaccination rates among the 5 to 11-year-olds. And as you can see, at least one dose, Santa Barbara County is roughly the same as California and the US. However, and if you look at the fully vaccinated, the right-hand side, we are quite a bit ahead of California in the proportion of our 5 to 11-year-olds as fully vaccinated. If I am next. This describes vaccination rates among the 5 and 11-year-olds. And you can see that uh, uh, with the different among different ethnic communities, the whites have the highest, at least one dose at 19.1, followed by children in the Asian American community. What is worrisome is that among our communities of color, in particular, the Hispanic and the Latino and the multiple races, as well as the Black and African American community, those numbers lag behind. And it really speaks to our continued need to partner with community organizations, trusted community advocates, and community leaders in outreach efforts, as well as in providing access to vaccines. Next. This is vaccination rates among 5 to 11-year-olds by region. As not a surprise, we are seeing a bit higher vaccination rate in South County, and this is pretty reflective of the overall vaccination coverage in our whole population, that we're seeing typically more coverage in South County. Next. This is percent of boosters among fully vaccinated individuals in Santa Barbara County. So to date, we have 84,992 boosters administered to Santa Barbara County residents. Comparisons with national and some state data on boosters among the fully vaccinated, we can see that Santa Barbara County have 2% higher than our state data, and a little bit lower compared to national data. The second cluster from the left, so among the 18 and above, we have a roughly 2.3% higher than the national data. When we look at data among the 50 plus group, we have about a 6.6% higher than the national data. And lastly, when we look among the 65 and above, Santa Barbara County is seeing a 8.4% higher than the national data. Next, percent boosters among fully vaccinated by race and ethnicity. We're seeing the highest percentage among multiple race category, followed by the white category. Following other state and national trends, again, we are seeing lowest percentage of boosters received in the Latino Hispanic community. Next. This is a percent booster of fully vaccinated by region. Again, not surprising. The higher percentage is in the South County and the lowest is in North County. There's roughly about a 10.6% difference between South County and North County. Next.
Dr. Doverdoso, before you
Yeah.
go on to the CDC or the CH or the next set of slides, I was confused by one of the slides. Can we go back quickly? And sorry to interrupt you, but
Oh,
slide
sure.
slide 11.
Yes.
I was trying to figure out what this represents. So only 1% of the North County ages
So
5 to 11 are vaccinated or have one dose, but then it doesn't seem to add up to the same numbers that you had on the earlier slides.
yeah, so when we look at when we tease out the population of 5 to 11-year-olds that live in North County or
Okay.
that live in Central County or that live in South County, we're seeing these numbers.
So only 1% of North
Correct.
County children. So
Correct.
how do we get to the 15% number that you had earlier?
I'm sorry,
So if you
which
go back
number?
to slide 9, and I apologize, I should have asked earlier. But so we have 15% of the total 5
Yes,
to
so
11-year-olds, but then all of a sudden we go down to 1%. So I don't get it. So 15.3 total for the county, but then if you
right.
but then we go down 2 slides later and it's 1%, 1%, and 1.7. So
Yeah, I can see that.
okay. So
Yeah, I can see that.
all right.
You know, I can see where that's confusing. Let me look into the raw numbers.
Okay. Maybe that's
Um,
something. Maybe that's something you can send out to us later. It seems that
yes,
it's a little bit off. So
yes.
okay. All right. Thank you. Sorry.
Okay. No, thank you for catching that. And I will look at the raw numbers and provide to your board clarification.
I appreciate that. Thank you.
Great. So on slide 16, as you may have heard yesterday, CDPH issued new guidance for universal indoor masking statewide, effective 12/15, and will last until January 15th. Today, CDPH issued additional clarification that states that any county that have existing local health orders, those like Santa Barbara County, those existing health officer orders will continue to apply. They are issuing this clarification to mitigate any disruption of current efforts with industry or exemptions already occurred at the local level. CDPH has also maintained exemptions for indoor sports and have included exercise and conditioning as exempted activity in their health officer order. And they are including exemption for performers and recommend weekly screen testing. And they also acknowledge that there are still outstanding questions related to Cal OSHA and the workplace, and they will be meeting with Cal OSHA to get some clarity. In addition to the universal masking order issued, they issued clarification requirements, I'm sorry, on events with more than 1,000 people will need proof of vaccination or negative tests. And that testing is tightened from 72 hours. So now it is 48 hours before the event with a PCR test and 24 hours before event with the antigen test. Additionally, they are issuing a recommendation on testing, and that is applicable to all travelers to California or returning to California. And that needs to be done within 3 to 5 days upon arrival. Next, I'd like to transition to Dr. Ansorg, who will be giving your board a briefing on the Omicron variant.
Good evening, Chair Nelson and members of the board. Omicron is on everybody's mind, obviously, and we get to know more and more about this new variant almost by the hour. So some of the slides that I prepared yesterday are already outdated. The Omicron definitely gets me worried. I have to say that. The reason for that is that it has a lot of mutations. For instance, Omicron has at least 30 mutations on the spike protein section of the genetic code, compared to the Delta variant that we are currently still dealing with, has only half of it. What these changes apparently are doing is that they make the virus faster to spread, and it protects the virus somehow from the immune system, which is very unfortunate. Next slide, please. This is a 3D picture of the spike protein comparing the Delta to the Omicron spike protein. The spike the receptor binding area is the orange, and you see that in the Omicron there's a lot of red dots in there. That means mutations. So the receptors are the structure of this area is definitely altered compared to the previous version. Next slide, please. The doubling time, which basically means the speed, how fast this variant is replicating, is much faster than compared to Delta. Delta was much faster compared to Alpha, which we had last winter, and then Delta took over in the summer, and now it looks very much like Omicron is giving Delta a run for its money. It is definitely more contagious than Delta and spreads faster, and therefore it has already outpaced the Delta variant in South Africa. At this point, South Africa has already about 90% of new infections due to Omicron. The United Kingdom, that currently harbors most of all Omicron cases in the world, already has 20% of new infections due to Omicron. Another reason why it worries me is that there is a much higher rate of breakthrough cases than previously with Delta. Also, there's a much higher rate of reinfections. People who had COVID in the past and had some natural immunity against it are now prone to get reinfected much easier. A third dose of our vaccines is definitely helpful in improving the protection against more severe disease with Omicron. With Delta, it was the second dose was absolutely necessary to reach a better protection. Now, a third dose is required because this virus, new variant is able to bypass the antibodies. It is yet unclear if the morbidity and the mortality is less severe than Delta, but all signs are hinting towards that being the case, meaning that more people get sick, but they don't get as sick as with Delta. Next slide, please. Next slide, please. Oh, isn't there another one before? Thank you. So As I mentioned, the UK has by far the most confirmed Omicron cases worldwide. It is causing a new surge in the UK, and they implemented new measures. Here it says 40% of new infections in the UK are due to Omicron. The 20% I mentioned earlier was already outdated. It has the potential to replace Delta worldwide due to the speed of the transmission. The rate of breakthrough infections is much greater than with Delta. And we are waiting to see how many people have to get hospitalized due to it. Given that we trail the UK usually by 6 to 8 weeks, we will only be dealing mainly with Delta for the next 2 months. This is what I wrote yesterday. That's already outdated with new information that's come out today by the CDC. I don't have a slide on that, so I have to read it to you. They're estimating that the United States already has, in general, 3% of all new cases are due to Omicron. There are some areas like New York, New Jersey, Puerto Rico, and Virgin Islands has an 11% of new infections already due to Omicron. This is concerning because a week ago, the general rate was only 0.4% for the United States, and then a week later was 2.9%. Now the 2.9% was estimated on Saturday, and now is Tuesday evening, so it may already be double because the virus, replicates at increased speed. It only takes 2 to 3 days to double the numbers. So some things about that are very alarming. If the cases indeed increase exponentially, as expected, the sheer number of infections, even if people don't get that severely ill that they need hospitalizations, but the sheer number of infections will make weaker people with weaker immune systems sick, and it will likely put a strain on our healthcare system. Even if vaccination does prevent severe disease and death, but it does not prevent infection with Omicron and therefore spread of Omicron by vaccinated people, that really makes it really necessary for us to pivot and rethink how we deal with vaccinated versus unvaccinated people in the community. We will have to slow down the spread via social distancing, via masking. Frequent testing is very important. So that's why we have to resort to our proven measures of slowing down spread of viruses in general. And that's why we have this, next slide please, this Swiss cheese comparison, that the more different measures you put on top of each other, the better the protection against spread of a particular virus. And with that, I defer back to Dr. Dorenoso, excuse me.
Thank you, Dr. Ansorg. As Dr. Ansorg mentioned, what our comms team and what our community partners are consistently doing and will continue to do is really to communicate that the more steps you take, the safer you are against COVID-19. And so we know that these safety measures include good ventilation, hand hygiene, face masking, physical distancing, and these are all really important as we enter into the holiday gatherings, and with a lot of those gatherings taking place perhaps indoors. And then, of course, being fully vaccinated. So starting that vaccination journey or getting the booster shot. These are all proven strategies that will keep our community healthier. Next. And I would like to, can you hit the play button on that slide? Oh, awesome. So we want to wish our community, your board, the CEO's office, happy holidays. And we would like to give a big thank you to our amazing businesses and our valued community during the pandemic. We totally appreciate your dedication and your commitment to doing your part to stop the spread of COVID-19. So let's, during this holiday season, let's be safe by taking precautions. Let's be smart by staying informed, and let's be kind by supporting each other. Thank you.
Thank you.
And that ends our briefing for today.
Thank you, Dr. Doverdoso.